Our third talk comes from Dr. Nadine Hamilton, who is speaking about understanding and supporting veterinary mental health. Dr. Hamilton helps veterinary professionals get on top of stress and conflict. She has successfully completed her doctoral research into veterinarian wellbeing and is the proud founder and CEO of the charity Love Your Pet, Love Your Vet.
Hi there, I'm Dr. Nadine Hamilton, registered psychologist from Positive Psych Solutions in Australia. And today I'll be talking to you about understanding and supporting veterinary mental health. In particular, I'll be sharing with you my perspective and from the work that I'm doing about what's going on in relation to veterinary mental health, what the research shows, and importantly, what we can do about it. First of all, let's have a little bit of a deeper look at what's going on. Sadly, as you may be aware, there is a disproportionate rate of suicide within this profession. If we break that down to some of the larger countries where we have those statistics, in the United Kingdom, it's reported the veterinarians have a suicide rate of up to 3 times higher than the general population. Here in Australia, it's up to 4 times higher than the general population, or that equates to around 1 veterinarian suicide roughly every 12 weeks. In the United States, it's reported that female veterinarians have up to 3.5 times the likelihood to suicide than the general population, and male veterinarians up to 2.1 times the likelihood to suicide. It's also been reported that 43% of veterinarian deaths are due to suicide. I think it's also important to note too that not every death has the occupation recorded on it, on the death certificate. So we don't always know the occupation of some individuals who choose to take their life. So it could in fact be higher. And obviously, you know, we have to take into account some accidental but ruled as suicide or vice versa. But this is just what the statistics have been showing us. It also works out, I guess, if you're looking at it globally, between 41.8 to 52.6 veterinarian suicides per 100,000 of the population. So I think that just sort of puts it into perspective of how disproportionate or how serious this actually is. There's also high attrition rates. So there was some research conducted here in Australia, across Australia and New Zealand about 2 years ago, and the attrition rate was reported at approximately 38%. So that's pretty high when you think that potentially, you know, nearly 40% of the veterinarians in practice across Australia and New Zealand are leaving the profession. Whether that equates the same in other countries, I would, I guess, assume, or based on the information and the research that I have, that would be fairly similar, or it would be reasonable to assume that it's potentially going to be fairly similar across the globe. There is a reported veterinarian shortage. Again, this isn't just in Australia, this is globally with clinics. I know there are reports of some clinics trying to find new staff, veterinary staff, and taking up to 3 years. I know there are some estimates, roughly 18 months to find a new vet to come and join the clinic or the practice there. So there's a lot going on, particularly when we're looking at those shortages as well. Also, with what's been happening around the world in the last, year and a half, nearly 2 years now, with restrictions on travel. So that has, I believe, had an impact on being able to immigrate or emigrate, and work in another country. So that's also, I believe, contributed to the shortage happening. Also, as I said, this isn't just exclusive to one country. This is actually a global issue that is affecting many countries around the world. In my work, I work exclusively with the veterinary profession, and I do work with veterinarians and organisations around the globe. And these are the same issues that are being reported. So it doesn't matter whether I'm talking to someone in the UK, whether I'm working with someone in the US, or even here in Australia. the same things are being reported. You know, the high attrition, the difficulty finding new staff, sadly, that disproportionate rate of suicide. We also know that it's not just exclusive to the veterinarians, that sadly the suicide does affect the other veterinary and animal workers. We just don't have solid research, not that I've been able to find anyway, on what those statistics are, but I know firsthand that sadly we are losing other veterinary workers and professionals, and not just the veterinarians across the globe. So looking at what the research shows, and as I mentioned, I completed my own doctoral research over a 6.5-year period, specifically looking at why why does this profession have such a high rate of burnout and suicide? From my own research, I was able to narrow that down to 5 main contributing areas. So I want to share each of those with you now, a little bit more detail. And again, you may be aware of them. You may be able to relate to them and going, yes, that absolutely is an issue for me if you're practicing. For some, they may not be as big an issue, but definitely these were reported, and the data was saturated, essentially, which means that the same things were being reported over and over and over again. And now these aren't in any particular order, but I will just say that performing euthanasia was, from the research and the literature that I was researching and reading, euthanasia was originally reported as probably the biggest contributing factor. So when I set out on my doctoral research, I had that in mind, and I was really wanting to find out, okay, well, what is it about performing euthanasia that is so stressful? But it became apparent that euthanasia wasn't the single most contributing factor to the high rate of suicide. Certainly, it was reported by the majority of the participants in my research, but not all of them. So not everybody had an issue with euthanasia, but the majority did. And some reported it was because of the severing the human-animal bond. It could also be related to the circumstances surrounding that euthanasia. If it was an avoidable euthanasia, and by that I mean if it was something that treatment could have prevented the euthanasia, or rehoming the animal could have prevented that euthanasia, so particularly along like convenience euthanasias, that's where it was reported to be quite a stressful factor, and why it was such a contributing factor for many when it was seen or perceived to be avoidable. Depending also on who the animal was, their relationship to that animal, if it was from their favourite client, or perhaps it was their own pet, or somebody close to them and their pet that they were having to euthanize, that obviously contributed to that being a stressful factor. But certainly, as I said, I have interviewed vets and worked with vets who have the philosophy that euthanasia is just another form of treatment, and therefore it's not a really big contributing factor for them. So I think it is a very individual factor, but certainly the majority of the vets from my research reported it as a contributing factor. Compassion fatigue. This is where that fatigue comes from being so compassionate. So as veterinary professionals, naturally I would say you have a tendency to be compassionate, particularly towards the animal. I do have a theory that veterinary professionals, particularly the vets, if you're the one that's doing the consultations and talking with the clients, working with the patients, that you have a double whammy. So compassion fatigue is very prevalent within the helping and healing professions. But for most of us that are working with our human counterparts, we're just working one-on-one, human to human. But for those of you working with animals, generally you will have the human that is bringing in or caring for that animal, as well as the animal itself. So not only are you showing compassion to the owner who might be going through a distressing time, making life-changing or life-ending decisions for their beloved pet, but also for the animal itself who may be suffering, and maybe the owner doesn't want to do anything to ease that suffering. So all of those considerations came into that. Financial issues. This had two different aspects to it. there was the financial aspect of the cost of treatment and customers complaining about it's too high, you're just in it for the money. If you really loved animals, you'd do it for free. I can't afford that. I wasn't the one who brought my animal in who was hit by a car, so why should I have to pay for it? The snide remarks, all of those sorts of things are like complaining about the cost of treatment. Along with the cost of treatment, though, is the other end of the scale where the client did have the money to pay for it, but then had the expectation that that money could pay for anything. So they would be the kind of clients that I don't care what it costs, I just want you to fix my animal. And again, fix, you know, metaphorically speaking, or their demands may not always be possible, as you would well be aware. On the other side of the financial issues was also the stress for the owner of the business, running a business, you know, and essentially running a vet business, whether it's a clinic or a hospital practice, you know, however you refer to your business. It's still a business. There are still overheads that have to be paid. There are still responsibilities. You know, you still have recruitment issues, equipment needs, and resources. So all of these things were also found to be a contributing factor. Unrealistic expectations. This is another one that was twofold. So on the one hand were the unrealistic expectations that other people place on you. That could be the client who has the unrealistic expectation, which could tie into a lot of the financial aspects, that they want the gold standard treatment, but they only want to pay with bottle tops, or fix my animal, you know, even though it was no longer compatible with life, but they still have this expectation that you can fix it. Some of the reports that I have heard can be that some TV shows can exacerbate that, where they just show the happy endings and not necessarily the reality or the not so happy endings. And I know some do that, and they do it very well. But there can be this perception that you're a miracle worker. No matter what's going on, you're able to fix their pet, regardless of what's happening. As well as the unrealistic expectations you may place on yourself, that you have to be perfect, you can't make a mistake, you can't ask for help, you have to work 12 hours a day, every day, otherwise you're not a real vet. You know, all of these sorts of things. And these are some of the things that I hear on a daily basis from the clients that I'm working with. You know, and a lot of these expectations are unrealistic. And then, of course, there's the difficult clients. This could be from a whole range of different reasons. But I guess some of the more common ones that I've heard were the non-compliant clients. So you might give them a treatment and the medication for, you know, or the treatment for their pet, and then they don't follow it. Then they come back and complain because their pet hasn't improved. It could be the ones who are complaining about everything. They had to wait for 5 minutes. They can't get into a same-day appointment. Why should I have to pay? Because you should be a community service. Some of them are just rude. They might be stressed and distressed. You know, there could be a number of reasons why they're being difficult, or you're perceiving them as being difficult as well. But they were the top 5 contributing factors. So the good news is, though, there are some things that we can do about it. And you know, it probably is a much more broader perspective than what I can share with you in this short time here. But just to summarize a couple of the things, and probably the most important thing that I would say is, don't suffer in silence. There is so much help available. It just means you have to have that courage, you know, to be able to reach out and ask for help, whether that is to a friend that you trust, a colleague you trust, a loved one, or actually going to a healthcare professional, a qualified professional who can assist you in this regard. There's my coping and wellbeing program. This was something that I actually tested in my doctoral research, and it was statistically significant in reducing stress, anxiety, depression, and negative affect. There is an abbreviated version of that in my book, which some of you may have already had access to. Utilising your workplace employee assistance programs. So they're the EAP programs where the employer pays for a certain amount of sessions on your behalf, where they're confidential sessions, but it is just something that a lot of workplaces do as part of their wellbeing programs. Of course, independent counselling. So seeking out a qualified counsellor, an experienced counsellor, or someone who is familiar with what it's like to work in the veterinary profession. I know that there are not a lot that I know of who have that particular expertise in this area, but it is something that we do have some of those workers within Love Your Pet, Love Your Vet, which is my registered charity here. But talking with your GP, or talking whether you're talking to a psychologist or social worker, another professional who does understand the profession, because in my experience working with clients, it is something that has been reported to be really important, that the counsellor or the psychologist understands the industry, because it's not just your 101 basic sort of counselling. You have to, I believe, have a really solid understanding of what's actually happening. Reach out for support. There's so much support available, whether that is your industry associations, whether it is charities. I believe VetLife in the UK, has some amazing support there. We have Love Your Pet, Love Your Vet, my charity, that yes, we're based in Australia, but we do provide global services, also globally, and based in the US, Not One More Vet, or NOMV as it's referred to. So there are a lot of support avenues out there, but look for those, or I'd recommend that you look for those that are specific to the veterinary industry, because you're more likely to find that they will have resources and an understanding that is specific to the industry. And of course, without sort of making this sound like it's all about Love Your Pet, Love Your Vet, but this is the charity that is exclusively for the veterinary profession. We are global. Just even if this is a starting point and you don't know where to turn, please reach out to us, because we're happy to point you in the right direction. But look for those resources that are out there. Look for what else is provided with you. I do understand the Royal College of Vets had the partnership with Kite Veterinary, or Kite for Vets as well. We have an affiliation with them as well, through their wellbeing app. Those sorts of things, they're the kind of things that can help from that self-care perspective. Thank you so much for joining me. I know this was rather short and brief, but please feel free to reach out if you do have any queries or you'd like to know more. I'm more than happy to, discuss that with you and try and help point you in the right direction. Thanks again so much. I really enjoyed presenting this, and I hope that I've been able to share some relevant information with you today. Thanks again. Bye for now.